Relatively safe, probably here. Would be the best
Good? Okay, cool. Thank you.
Actually, no, I would be on the concrete
Up.
right there.
Hi.
Yes, and
Okay.
a little bit right there.
Do whatever Tom says.
Don't a little bit right there. That's good.
Perfect.
That way that everybody can do their double shot and we can all see you.
Okay, no problem.
All right.
Very good. Thanks so much.
You're welcome. I would have brought my clear mask, but I can't.
No worries. Thanks so
You
much.
look very nice today.
Thank you.
59, thank you.
Perfect.
Good afternoon. Thanks for joining us today. My name is Commissioner Jeremiah Ray Blocker. I'm the Board of County Commissioners for St. Johns County. I want to thank everyone for coming today. Our goal and demand here in St. Johns County is to make sure that we are vaccinating each of our residents that are at risk in the most effective, efficient, and safe manner possible. Now, up to this point, St. Johns County has received up to 3,000 doses of the Madeira vaccine to treat our at-risk public. The Department of Health has been the lead agency here in St. Johns County in this endeavor. St. Johns County this week has realized we've not run into a number of challenges with this. We've run into some challenges with scheduling, with the actual process for people to register and come in. So what we've done as county leaders, we've asked and reached out to the Department of Health. We've asked them to allow us to expand our partnership. So what we can do is use the county resources that we have to bring to bear. We feel that we can help improve this process, we can help further this relationship and partnership, and we can make sure that each of our citizens' needs are addressed. I think what's been evident to the public up to this point is that, again, we've had some significant challenges in this regard. Up to this point, we knew coming into this that there was going to be high demand and limited resources. The state of Florida had a plan to address that. But the demand has been significant and has led to some significant challenges for us. So we feel that getting county government involved in this process will help assist and go from there. Again, what we're looking for, what our expectation is as county leaders, is we want to be effective, we want to be efficient, we want to be safe, we want to make sure that our citizens know where to go, where to sign up, where to get vaccinated, and then where they come back 28 days later to get the additional second dose. And there's a way that we can do that and improve on that. So what we're going to do today is we're going to address that. Again, there will be some challenges going forward. Whenever you have high demand and limited resources, we're going to have some challenges here. But we want to make sure that our citizens are taken care of, and that's important. And we're going to do everything in our power to do that. So today we have representatives we have our Sheriff-elect, Robert Hardrick here. We have our Fire Chief here, Chief Pravat, and also the County Administrator here, Hunter Conrad. Mr. Conrad is going to outline for y'all what this is going to look like going forward starting next week. And Dr. Dawn Alicott, who's going to follow me here, she also is going to brief on the partnership that we've entered into with the Department of Health so we can improve, facilitate, and move forward in this process. So this time I'll turn over to Dr. Alicott.
Good afternoon. I'm Dr. Dawn Alicott. I'm the Director, Health Officer, and Medical Director with the Florida Department of Health in St. Johns County. I wish to begin by sharing with you how exciting it was to receive our first allocation of 3,000 COVID-19 vaccine doses last Monday, December the 28th, and immediately began vaccinating the very next day. This vaccine is a scientific and medical triumph. The COVID-19 vaccines are a light at the end of a very dark tunnel in which we have been for more than a year with this terrible disease, which has affected so many of those in the community. The mandate for our county, per Governor DeSantis, is to begin by vaccinating healthcare workers and our over 65 years old individuals who have been shown to be significantly vulnerable to this deadly disease. Residents in long-term care facilities are scheduled to be vaccinated by a public-private partnership between the federal government and CVS and Walgreens pharmacies, and this process has begun in St. Johns County. I'm pleased to report that an ongoing partnership with St. Johns County, there is going to be a closer collaboration with St. Johns County Emergency Management and St. Johns County Fire Rescue in the future distribution and administration of COVID-19 vaccinations in St. Johns County. The goal of all is to ensure that those who need the vaccine receive it in as efficient and expeditious a manner as possible, as we are all aware that COVID-19 vaccinations are our best option to get back to normal life as soon as possible. While we wait for this life-saving vaccine, we must continue to be vigilant to protect ourselves, our loved ones, and the community, as COVID-19 disease is currently increasing in Florida and in St. Johns County, with recent all-time high case rates and positivity rates in this past week. So please, wear a face covering, socially distance, and stay home if you're sick. I look forward to continuing to work with St. Johns County Board of County Commissioners and administration and our community partners to distribute the COVID-19 vaccine as safely and expeditiously as possible as vaccine becomes available. Thank you.
Okay, wait, I've got one question for you, real fast, if you don't mind.
If we can hold the questions to the
Okay.
end. Thank you. Thank you. We'll have time to make everyone available for questions after this. So right now, I'm going to ask our County Administrator, Hunter S. Conrad, to come forward, and he's going to outline how we expect this to play out the next couple of weeks and going forward from there, how we're going to expand our vaccination efforts and go from there. So, Mr. Conrad, if you can come forward.
Thank you, Mr. Chairman. Good afternoon, St. Johns County. Just to reiterate Dr. Alicock and Commissioner Blocker's comments, the purpose today is to outline a path forward to fix a lot of the problems that the community has seen and heard and that we've all received feedback on. So today's purpose is to partnership moving forward to address a lot of those concerns. So what I want to do now is lay out the logistics of what you can expect going forward. We recognize that there's going to be a number of problems that will continue to be ongoing. This is a national program that's going out throughout the country. And so what we've done is outline the plan today for going forward for St. Johns County. So if you'll stick with me and bear with me at the end, I'll open it up for any questions that you may have related to the logistics and what it looks like if I don't address those questions. Beginning on Monday, January 4th, that's this coming Monday, St. Johns County will begin the administration of the new COVID vaccine program in our county. So as you heard, the Department of Health to this point has been handling the administration of the vaccine. Beginning on Monday, St. Johns County will take over the administration. The new program will be administered at the Solomon Calhoun Center off of State Road 207 in St. Augustine. The first dose vaccinations for those people who are receiving their first dose will be administered from 9 a.m. to 4 p.m. on Mondays, Wednesdays, and Fridays, and I will address why that's not Tuesday, Thursdays, and Saturdays at the end. The program will no longer be on a first-come, first-served basis. All vaccinations will be administered by appointment only. Those who go to the Solomon Calhoun Center, and I can't reiterate this to the public enough, we want to communicate this to them so people don't waste their time and their resources. Those who go without an appointment will not be given a vaccination and they will be turned away. So we don't want to waste people's time who are coming out trying to get it on a first-come, first-served basis. That is the purpose of putting an appointment in scheduling place in practice. At this time, we have a limited number of doses that'll be allocated to the waiting list that has already been compiled by the Department of Health in St. Johns County. Once we're able to administer the vaccines to the current waiting list, we'll open a registration system for those populations currently authorized to receive the vaccine under the state of Florida's guidelines. As the program evolves and residents return to receive the second dose, those doses will be administered on Tuesdays, Thursdays, and Saturdays, also by appointment only. This program is separate from the vaccines being administered by Flagler Hospital and by other private care providers within the long-term health care facilities that you heard Dr. Alicock reference. This is a rapidly evolving program and could become more widely available upon receipt of additional vaccines. More information will be released as soon as it's available. There's a few resources I want to point the community to. First of all, you can visit our St. Johns County website at www.sjcflstjohnscountyflorida.us/coronavirus/vaccinations. Our emergency operations hotline is open now 7 days a week from 8 to 5, so residents can call if they have questions at 904-295-3711. I'll repeat that number. It's 904-295-3711. And as many of you know, you can now sign up to receive text messages alerts that will give you the latest up-to-date information as we receive it at SJC Vaccine. If you'll type in those words, SJC Vaccine, all in caps, to the number 888-777. Again, that's 888-777. So where we stand currently with vaccinations is on Monday, we plan on vaccinating approximately 200 citizens that are already currently on the waiting list. So appointments are not being made for future dates as of yet. The reason for that is we do not know when the next shipment of vaccinations will come in. We have been given some information from the state and the Department of Health at the state level that we can expect to receive another shipment this week, but at this time we do not know how many that will be or when it will be coming. So at this time, although we will be setting up for a Monday, Wednesday, Friday vaccination schedule 9 to 4 at the Solomon Calhoun Center, we don't have any appointments available other than those who are already going to be pre-scheduled on Monday. As soon as we get that information, we will then process it. It will be put up on our website that I just referenced. People will be able to call in and help get booking on there, and they will also be notified through our text message notification system. At this time, I'm going to open it up for questions. If I'm unable to answer any of the questions that you may have, we have our emergency management director standing by, our fire chief standing by, as well as our sheriff-elect.
Okay, so the second dose of
That's correct.
Same time, 9 to 4?
9 to 4.
Okay, we had a lot of viewers asking us at the site yesterday, you know, why is it that only a couple of hundred vaccines are able to be given out each day?
So I would say this first of all is we want to focus on going forward, but let me answer this, and this is why the reason the county has stepped up to try to help facilitate this. Ultimately, this is a resource and manpower issue, and so that's why we're stepping in. Still, you're taking 9 to 4 with appointments. It's still going to be limited, but also it's only going to be limited to the amount of vaccines we receive. So even if we get 400 or 500, there's only so many that we can distribute. To this point, the county originally got 3,000 through the Department of Health. It was a resource issue, and that's why the county has stepped up to try to provide those additional resources. And that's the answer to your question as to why only so many. It was a resource issue. But we're looking forward to the partnership going forward. We're confident as we move forward. We have the ability to expand. We don't have where the next expansion site will be to give to you today, but we are looking at expansion testing, especially if we receive more vaccinations in the future. Any other questions?
Did we consider at any point trying to get any help from the National Guard when it comes to the distribution, or was it just a county takeover?
I would have to defer to Dr. Alacock on that for their initial, their first week. I believe that part of the National Guard was activated to support their role. To what level of detail, I am unaware. We made the decision with the support of the Board of County Commissioners and all the requisite agencies to go ahead and move forward to help step in and resolve the problem as quickly as possible. As you know, we're set up for this. We just got through testing. The county has gone through multiple hurricanes, so it's a collaborative effort between all the agencies. I know that we'll be in touch with the Guard as well. I'm confident that the TAG through the governor will be more than willing to assist if we do need that.
Okay, so for our viewers who are going to be watching this tonight,
Yes, ma'am.
You know, it's by appointment only, and all of those appointments have already been filled, correct?
That's correct. As of now, all appointments are already booked. St. Johns County is beginning our vaccine distribution process where we're coming in to fill that gap starting on Monday. As soon as we receive or hear from the State Department of Health that we're receiving more vaccines, we will immediately put out a release to the press to help us coordinate that. We'll send it through our communications plan. We have a communications team on social media. We'll also be putting it to those who register at 888-777. I can't express enough the importance of registering on that. That's going to be the quickest way to get that information in your hand to register, because as you can imagine, I hate to get into assumptions, but if there's 1,000 vaccines that drop on Tuesday and there's 30,000 seniors over 65, and I'm using hypothetical numbers, there's going to be a backlog. So it will be first come, first serve by appointment. It will not be first come, first serve at the distribution place. So there will be a need and a necessity to call in quickly. That's why we want to make sure we're giving these resources to the community so that they know as soon as we get that information, we're going to push it out. We want to make sure, especially those who are in our vulnerable populations, are being vaccinated as quickly as they can, as quickly as they want to be.
How can you guys ensure that, you know, your system isn't going to crash? Because it's going to be a lot of people jamming it up.
It is. So we have already started crash testing it to determine whether or not it will. Let me be very clear, though. I think it's fair to set realistic expectations. Realistic expectations are that if 50 or 75,000 or 100,000 people try to call all at once, there's only so much we can do. It will be rebooted. We have IT standing by. We've brought in a number of resources to answer phone lines here. We have over 15 people that will be in there 7 days a week that will be answering phone calls, trying to assist people, especially if something goes down. So the answer will be if somebody calls and say, hey, the system went down, we anticipate using Eventbrite to do the booking system. And so if for some reason it does go down, we'll have people stand by waiting to help those people who are questioning that.
And again, it's sjcfl.us/coronavirus, right?
/coronavirus vaccinations.
And that's where they can go to register.
No, that's where they can go to kind of keep updates.
Okay.
And that's all for today. If you have any further questions, please let us know. Thank you for being here. I'm going to turn it back over to the chairman.
Thank you, Mr. Conrad. And again, we appreciate everyone coming today. The board took action last week by sending a letter to the Department of Health, and we appreciate Dr. Alacock and her team and the State Department of Health allowing us to come in and further our partnership. We feel that's going to help save lives and serve our community. So right now we have our fire chief here, Chief Pravat, and our sheriff-elect, Rob Hardrick. If there are any questions for them, or do y'all have any comments? Okay.
Can they answer? Can they come up and
Yes. Yes, absolutely. Gentlemen, if we can have y'all come forward, we have some questions.
Yes, it is.
And so going into this new system,
think that you're expecting not to see what we've seen in the last few days, those long
Sure.
lines, people cutting. There was a lot of concern
Sure.
About that. So we'll talk about the advantage that this new space gives us so that we can distribute this vaccine safely.
Sure, absolutely. The first thing I want to address first is that this morning there was a public safety concern hazard that was addressed. The St. Johns County Sheriff's Office, once we learned of the information, we actually reallocated some resources around the county. Our traffic units actually reallocated back to the St. Johns County Command Center area, and we actually put all the cars on US 1 and Lewis Speedway were moved into parking lots for safety. So that's number one. The second thing, as Mr. Conrad said and as Mr. Chairman said, we are going to a control process, meaning that it's appointment only. And again, he reiterated numerous times that it's appointment only. So the drive-up service we've currently had and have tomorrow will cease, which will make it easier for us in public safety.
So the same plan to get them into that parking lot for tomorrow will be that's going to be the same type of plan that we do for tomorrow?
Yes, ma'am. I'm glad you're asking that too. So the same procedure that we changed to today at Department of Health will actually happen tomorrow. The entrance will be off of Lewis Speedway. Again, she has a limited amount of vaccines for tomorrow, so presumably those numbers will go pretty quick. And with that being said, again, that is the procedure for tomorrow. One more day of that only, just tomorrow. Yes, ma'am. Yep. And then after that, it goes to appointment only. Yes, ma'am.
Okay, so it's still first come, first served tomorrow, very limited.
I'm going to turn my back here and tell you, just to make sure, Dr. Allicock, it's first come, first served tomorrow for a limited amount of numbers. Yes, a limited amount of vaccines. Yes, ma'am.
And it opens at 9 a.m., right?
Yes, ma'am. 9 o'clock tomorrow morning.
We don't happen to know the number of vaccines for tomorrow?
Dr. Allicock, do you have a number for vaccines tomorrow, approximately?
Not exactly, since we vaccinated today. So at the end of the day, we'll have. Sorry.
Yeah, I'm sorry.
Sorry. At the end of the day, we'll have a better idea of how many we vaccinated, and that will give us a count for, what we have tomorrow. I do want to take this opportunity, though, to thank our Board of County Commissioners, and to share that while St. Johns County, the Health Department, the Florida Department of Health in St. Johns County remains the lead agency, it is really significant that our county has stood up to assist us. And we will continue to be the lead agency in terms of the vaccine coming in and the inventorying and ensuring that the data is transferred to the state as necessary, as our partners collaborate with us to ensure that it's more effective and efficient. I also would like to, before I move on, is to give kudos to the team at the Department of Health in St. Johns County, because we completed almost 3,000 vaccines from Tuesday afternoon until now, and that could not have been without help from the strike team, the regional IMT, and fire rescue, and the team at the Department of Health. I think it's important to give credit where it's due, and I appreciate the opportunity. Thank you.
What's the average time it takes for someone to get a vaccine approved already?
We do one vaccinator is able to do 20 an hour. That depends. Now remember, this vaccine is not like the flu vaccine or measles or polio, the regular vaccines. These vaccines require a particular storage and transporting type of mechanism. It also requires that we wait 15 minutes after administering it. If the individual has any type of allergic type phenomenon, it requires us to monitor for 30 minutes. That adds to the length of time.
So you said one person can give people 20 vaccines an hour, correct?
With support. If we've got a team, we can do 20, yes, in an hour. One vaccinator, that is.
Now I know people are, 28 days from now, we're gonna, have all those people who got their shots coming back. How are we all gonna kind of handle that?
We're working with our county administration, and they have a system in place that will make that happen. The individuals will be appropriately called. They will get the list from us. They will be appropriately contacted, and they will make appointments, and they will be taken care of. Again, we are believing that we will have the vaccine in 30 days. Please understand, this is a special commodity. At this point in time, it's not certain dates of arrival, but it's our understanding that in 30 days from this week, we should be having the second doses for those individuals of the 3,000 that we would have delivered between yesterday and Monday. Okay? Thank you.
I have one more question. I'm not sure. It may be for the fire department. I'm just curious as to in the new center, how are we planning on putting everyone in there safely with the number of staff that's needed, and all the folks that are getting the appointment, can you describe this space and what it looks like? How will we execute?
It's a big room that's got, we're dividing it up into sections. We've been working on a plan for several months. We will bring them in 20 at a time so we can manage them, get them through the process, bring the next 20 in. Our plan is to bring 20 citizens in for a vaccine every 30 minutes as long as we have vaccine up to 4 o'clock, and kind of manage it and control it, because we do have that 15-minute wait after the injection to make sure that they don't have a reaction.
And I'm not sure if it's too preliminary, but Doctor was talking about in the future help with the distribution with the fire department. Can we talk any about that?
Say that again?
Earlier she had mentioned future distribution with the fire department. Do we have any details on what that may look like? Would you all?
Well, I think we don't know what the next number of vaccines are going to be. So based on that will be based on how many appointments we can make and how fast we can get that vaccine out. We just don't know that information today.
And where is it that you guys are bringing the people in? 20 people at a time? What's like the address?
The
building? It was at the health department, right?
Solomon Calhoun. No, it's not the health department. Solomon Calhoun. It's off West King Street, between West King Street and 207. I think it's.
Okay.
Is it 1300, Joe? The address 1300 Duval Street.
Are there any further questions? Okay, thank you all so much for coming today.
Thank you. Actually, we have one quick question for you.
Sure.
Okay. So no word yet on any of these extra, like, additional sites?
So at this time, what we're going to do is we're going to evaluate the number of vaccines that we get. That will help determine the additional sites. Our goal is we want to vaccinate as many people as possible, but that's going to be based on what the state can give us. If the state can expand what they're able to provide to us, then we're going to expand our vaccination efforts.
Okay, perfect.
Sure. All right. Thank you.